Desflurane is an anesthetic gas. We call it a volatile. It's basically a gas that is used to keep patients unconscious during surgery. Anaesthetists in Scotland became aware some of our gases were particularly bad for the environment. So we have three options for anesthetic gases: desflurane, sevoflurane, and isoflurane. Desflurane is about 60 times as bad for the environment as the equivalent dose of sevoflurane, and that's due to its global warming potential. So that's the effect that it has on the environment over 100 years. And because desflurane has an atmospheric lifetime of about 14 years, it has a much greater effect on global warming than sevoflurane, which only has a lifetime of about a year. When I used desflurane back in 2016, my daily mileage equivalence for one day's work was about 4,500 kilometers of driving. When I switched to sevoflurane, that reduced dramatically, and also getting rid of another gas called nitrous oxide. From my practice, my daily mileage now is about 16 kilometers. Obviously, we have to put patient safety and successful surgery at the forefront of all our decisions. But by taking the sustainability angle on this one, we can show that there's equivalence really in the other anesthetic agents compared to desflurane, but a significant environmental benefit from not using it. The Scottish Government recognised the work that was being done, and it was incorporated into the new National Green Theatres programme as part of the climate emergency strategy. We had agreement from national procurement not to contract for desflurane from February 2023. So we think we are the first country in the world to actually take a decision not to contract for this drug anymore. By doing so, apart from a few very small clinical indications, it's effectively been removed from use in Scotland.